Okay, so hello, I hope all of you are doing fine, and just for the video's sake, my name is Dr. Shehbaz Ansari, and as of now I am fully GMC registered, and for the past maybe 1 month I've been teaching PLAB and guiding my fellow doctors in order to achieve their goals and just doing my bit. So today's consultation, today's lecture, today's session is solely going to be on telephonic consultation, as telephonic consultation is a really important part of the exams recently because of the rise of COVID, and more and more patients are actually approaching the doctors, the medical facility, through telephonic consultation. So initially, when the PLAB started, the exam used to have telephonic consultation, but because of the rise of the COVID scenario, the quotient of telephonic consultation has risen from 3 to 4 stations to approximately 5 to 6 stations. So even if you pay a lot of attention to telephonic consultation, so you can actually clear 5 to 6 stations. And since 10 stations are you need to clear in order to clear your PLAB-2. So yeah, if you actually pay a good amount of time and pay good attention to telephonic consultation, so there are only 4 more stations that you have to work upon in order to clear and ace your exam. So yeah, telephonic consultations by far are the most important part of the exam, and as I've seen a lot of fellow doctors, a lot of people actually do not pay attention to the telephonic consultation because they think that it's easier rather than the actual person-to-person interaction, because you don't have to work on your hand gestures, your physical appearance, how you sit, how you communicate, the non-verbal cues. You don't have to address those in the consultation. But that's the very thing which actually makes this thing a bit tricky, because a lot of people are unable to express themselves on the telephonic consultation, where you're unaware of the non-verbal cues, where you cannot actually do your hand gestures like this or something else that you like to do in order to make the person comfortable, or in order to showcase that you're actually engaged in this conversation. Okay. Thanks a lot for responding. Just that the more interactive this session is, the better it is, because I don't know what kind of mistakes I'm doing. If only you people just correct me, because I'm also learning through the process. So just coming back to the conversation, so telephonic consultation are a really important part of the whole exam, as in that station, in that scenario, you're only there alone with the scenario in front of you and a headset, and the audio will be given to you via a speaker. It's going to be pretty much audible, but whatever you're giving through is your voice, and whatever you're receiving is a voice. So you never know what kind of expression that person is giving you, what kind of a non-verbal cues that person is giving you, what kind of a hints that he wants to give you, which people actually tend to give you via non-verbal cues when they're sitting in front of you. So, and a lot of people are unable to show empathy with the lows and the ups of their voice. So in the telephonic consultation, you have to be empathic and sympathetic through your voice. You have to be subtle and you have to be soft where there is a very sensitive thing to say, and you have to be a bit aggressive at times, and you have to confront the patient when the patient is not giving you appropriate detail. So that's a bit of a hurdle when we talk about the telephonic consultation, because if you make a mistake in the telephonic consultation, there's too much of too less of a window in order to amend yourself, in order to recover from it. But in the actual conversation, when the patient is in front of you and you're sitting in front of the patient, a lot of things you can actually amend yourself. You can actually change your sense of questions. You can actually change your posture. You can move, and you can actually lean forward in order to elevate the thing that you want to say. So these are the things that you won't be able to do in the telephonic consultation. So, and the thing is that in order to evaluate the conversation in a telephonic consultation, you have to have the right questions, you have to have the right approach, and that is the very reason telephonic consultation tends to become a bit tricky. Although if you ask me, telephonic consultation is way more easier compared to the actual consultation, where you have to scout the room, where the person will actually give you some information, where he might give you some examination findings, some investigation finding. But in the telephonic consultation, there is no such thing. Whatever information that is in front of you, it is what there is, and no addition. The only additional information that you will get from the patient will be the history, and that's about it. And whatever management that you give will be a generic management, will be lifestyle modification, will be the advice that you give on a general condition, maybe hypertension. You would advise him to visit them, you would advise the patient to work out, you would advise him to cut down salt, you would advise him to cut down smoking. So these are the general advices that you would want to give the patient on the telephone. And if you think that okay, this patient should actually come visit us, so the best thing to do on the phone is just to ask the patient that it would be really good that if you could visit us, so we could evaluate you a bit more, and the consultant would also give it a look, so we'll be in a better position to give you a proper management and deal your condition appropriately. And the patient will be so much satisfied with you. And if you want to know the patient is satisfied or not, it will actually you'll actually know it on the voice. But when it comes to acting by a simulator in front of the patient might actually mask his expressions, but in the telephone it's pretty easy. And the most important and the most initial part of the telephonic consultation where you have to start is actually the introduction. That is by far the most trickiest part. But if you happen to have a good introduction, if you happen to have a really good start of the telephonic consultation, just believe me, just trust me, it won't go bad. And that is the very important thing. That is the most basic thing, which actually the doctors make a lot of mistakes. They do not work on their introductions. What I would suggest to you, that whenever you call a person, because most of the doctors in the exam, the scenario is going to be something what Mr. John has requested a telephonic consultation regarding some concerns. You're an FY2 in GP surgery or GP medicine or GP whatever. Call him back and address his concern, take relevant history and do an appropriate management. So this is what the scenario is in the task given. And what else is given to you? The person's name, the person's date of birth, the person's postal code. And most of the times you will be the person who is going to be contacting the patient. So the general rule of a telephonic consultation, which is be it a doctor, be it an engineer, be it whatever, whenever you call a person, so you are the person. I am calling, for example, I am calling Dr. John, or I'm calling Dr. Vijaya. So I am going to call him or her and introduce myself, like, hello, this is Dr. Ansari calling from the GP surgery. I'm an FY2 doctor, work in the GP surgery. Recently a telephonic consultation was requested by Mr. John. Is it Mr. John speaking? Oh yes. Then the person will confirm his name. Oh yes, doctor, this is Mr. John speaking. Yes, let's say hello, how are you? Yeah, I'm fine. Yes, recently you requested a telephonic consultation. So in order to continue, would you mind just confirming your date of birth so we could continue with this conversation? Oh yes, doctor, sure. You would confirm his date of birth. Then after that, you should confirm that, okay, could you please confirm me your postal code? He or she was going to confirm their postal code. In order, these things are basically done in order to make sure that whatever person you're actually talking on the phone is the actual person who requested a telephonic consultation. Because the importance of this thing is that you need to make sure that the privacy issues are also been taken care of. Okay, what if you want to talk to Mr. John and you end up talking to his wife or his sister or someone else, and you're not supposed to give irrelevant information to another person who you should not talk to. So in order to make sure that this is the person of contact that you wish to talk to, who has requested telephonic consultation, you actually address them from their name, ask their date of birth, and after that you should ask the postal code, and just ask that, okay, by any time if the call gets disconnected, is it fine if I call you back on this very number? Okay, that's really good gesture of making sure that everything should go fine during the consultation. After that, we do not know that what kind of a reaction that the patient might give when you start having the conversation. So you should make sure that you ask the person, I presume that is it the right time to talk to you, or is it the right time to talk to you? Do you mind if you have a conversation right now? Okay, or do you want me to call you back on some other time? Or if it's a written bad news, it's better that you just brace themselves, like, could you please go to a quiet room so we could talk in a seamless manner? Because there are scenarios where you might actually call them in order to admit of a mistake that you might have done. So the introduction tends to change from the case. Okay, so after that, once a person says, oh yes doctor, I'm okay to talk right now, then simply say, so how may I help you? So you have ticked all the introduction pointers that you need to. You introduce yourself, you've told why are you calling, and you've addressed the person from his name, so the introduction has already been done in an informal way. You've confirmed that, okay, is it the right person you're talking to, by asking their date of birth, their address. What if the call gets disconnected? Is it fine they could call you, you could call them back? And is it the right time to talk to them? And then, okay, so Mr. John, how may I help you? And then the history game begins. So the introduction, the initial 30 seconds, is by far the most important part of the telephonic consultation, because if you tend to work a bit on the introduction, your rest of the conversation will go amazing. But if you tend to screw up the introduction, it's going to be a bit of a tricky situation in order to get hold of the conversation later on. And after that, once you get the scenario, you'll ask open-ended questions. You'll ask the relevant information for which you want to gather the information, and then the patient is going to tell you all of it. So what is it that you want to talk about? How may I help you? The patient will tell you everything. And after that, just stick to the approach that I've been telling you, stick to the roadmap, and it's going to help you out. Okay, I hope I'm making any sense. So by far, is whatever I said clear? Am I going too fast? Am I going too slow? Is there any questions? So for me, if you ask, introduction is the most important part of the conversation, which most of the people should work. After that, once you've gathered all the information, since you cannot say that you cannot verbalize the examination and investigation, simply ask the person to come in so we could evaluate them by doing examination or investigation. And that's also to be said if it's necessary. Okay, so everything is going to be done according to the patient's convenience, and you have to make sure that whatever you are saying has to be politically correct, because you cannot actually give a diagnosis on the phone. Like, what kind of an FY2 has this kind of knowledge to actually diagnose cases on the phone? You need to examine the person, you need to investigate the person, and in every scenario, you also need to involve the consultant in order to make sure everything's going fine and no mistakes are being committed during this consultation. So, yeah, in a nutshell, this is what the telephonic consultation is about. The introduction should be very good, then the history taking, which is actually generic. The presenting complaint, the history of the presenting complaint, then the family history, the medical history, then the alcohol and smoking lifestyle history, which is what the person does, any social economic history if necessary. Then you just need to do ICE and give the differential diagnosis, or if you have diagnosed the person and you think that okay, this is what it might be, even then it's going to be a suspected diagnosis. And if you can just give him the lifestyle modification, it's fine. But if you need a bit more information, a bit more evaluation, it's best to ask the person that it's going to be really good if you could just come into the clinic and we could just evaluate you a bit more, and just convince the person to just come and meet them, so proper intervention could be done. So yes, so far this is how it is. And coming to the accents, most of the times this is a really important question that a lot of doctors had, that are the accents understandable? Are the dialect of the English understandable? Well, so far it is basic English, so it's going to be pretty understandable. And the audio quality, it's basically a speaker phone, so yeah, you might actually get a glitched phone, but so far I've not heard that the audio was not that clear. So yes, so far it is a pretty easy and doable station, and you just need a bit of a practice and some good solid introduction in order to make sure everything goes fine. Okay, and by the end of this video, in the WhatsApp group, I'm going to actually send a link of an actual GP talking to a person. It's a bit of a long conversation, but you just need to get an idea what kind of a conversation you have to do. And this is an actual conversation that GPs have with their patients on the phone. So you'll have a better idea, and I'm gonna just drop down the link of that YouTube video in the WhatsApp group, so you people will be able to get a better idea. So yeah.